Assalamualaikum warahmatullahi wabarakatuh. Good afternoon. A warm welcome to our colleagues in the media. In this session, allow me to deliver a brief update of the development of COVID-19 management in Indonesia. Many have taken to calling 2020 an unprecedented time, but the truth is precisely the opposite. We have long been vulnerable to devastating pandemics. The Black Death of 1346 to 1353, the introductions of the European disease into the Americas, and just 100 years ago, the 1918 flu, which is the first truly global pandemic that killed about 1 in 30 people across the world. What would have been truly unprecedented is if our vulnerability had ended. This pandemic, in all honesty, is a part of a very long-running trend. As we enter 2021, globally we are still facing our common enemy, the coronavirus. However, this year we enter this fight differently. With the experience we have gained last year, we have come to understand our enemy a little better. We are now also introduced to a new weapon that is the vaccine, which brings with itself a new hope that the fight against coronavirus will soon be over. Nevertheless, despite the light at the end of the tunnel, we must understand that this fight will be a long fight. As presently, we will still need to focus on managing cases in our own respective countries, promote behavioral change to prevent transmission among the people, and focus on treatment to decrease the number of casualties caused by the virus. Afterwards, we will still also need to focus on economic restoration and prepare ourselves of a life post-pandemic. With this knowledge, in 2021, the government of Indonesia is channeling its effort to combat COVID-19 via an evidence-based approach and culture-based behavioral change, while still initiating unique and innovative intervention. One such intervention is the proposed micro-scale mitigation, or PPKM, that utilizes the existing government apparatus, namely the armed forces, police force, local governments up to village level, as well as all elements of society, including religious and community leaders, to maximize the top-down and bottom-up approaches. In principle, our micro-scale mitigation strategy will target the smallest area of Indonesia, namely RT or RW. This micro approach is expected to be able to effectively overcome the pandemic problem at the RT-RW level due to its structured and comprehensive nature, thus ensuring collaborations in all levels of society, especially from a grassroots level. Our President calls upon the commitment and participation from all head of ministerial bodies, regional leaders, and head of COVID-19 task force in each region to coordinate and ensure the effectiveness of this micro-scale mitigation. I would like to update the daily cases as of 11 February 2021. The additional positive cases at this moment is 8,435, with the total active cases at this moment is 166,492, or 14%, with the recovery cases reaching 993,117, or 83.3%, whereas at the global level, the recovery cases reach 74.1%. The total death cases up to this point is 32,381, or 2.7%, where the death cases in the world is 2.19%. We find it important to highlight that as of today, the total recovery cases in Indonesia have reached almost 1 million. This is a good news for everyone, and I'd like to especially thank our health workers, who have worked tirelessly in this pandemic. Government is committed to support health workers in any way we can to ease the burden faced by them on a daily basis. Next, I will share the weekly development for positive, recovery, and death cases for COVID-19. It is important to look at developments from the trend of increasing or decreasing weekly new cases point of view, as this can indicate whether the transmission rate in the community is slowing down or not. The rate of transmission is largely determined by direct efforts, namely the 3M, health protocols, and indirect efforts, namely 3T, testing, tracing, and treatment. First, for positive cases, there was a 10.8% decrease in cases at the national level compared to last week. This figure is a positive achievement and shows a decrease in community transmission. However, there are 5 provinces that have to revisit efforts to deal with COVID-19 in their regions because they still recorded the highest increases in cases, namely Jakarta, NTT or North Timor, and then also North Kalimantan, and then North Sumatra and East Kalimantan. Of the 5 provinces, only Jakarta province, originating from the island of Java, is still in the top 5 with the highest weekly additions of positive cases. This is a good development because if you remember, in the past 4 weeks, the addition of positive cases has been dominated by the provinces from Java and also Bali. Second, for death cases, there was a decrease of 32% compared to the previous week. This shows that the treatment efforts carried out on COVID-19 patients are in accordance with the standard to reduce mortality rates. However, there are 5 provinces that still record the highest increase in mortality rates, namely NTB, North Maluku, Jambi, Maluku, and also Aceh. Furthermore, even provinces originating from Java Islands have all left the top 5 in terms of mortality rates. This is a good development. Comparatively, last week, West Java, Central Java, and Jakarta were still in the top 5. In addition, the increase in number of deaths have also seen a significant reduction, such as Aceh, with only 1 additional death cases, is in the top 5. This means the other 29 provinces do not experience a weekly increase in death cases. This is a very good development. Finally, I will share the development related to the recovery cases. Compared to the 2 indicators for the development of the COVID-19 cases that I previously mentioned, the recovery indicators decreased by 4.2% compared to the previous week. Even though it has decreased, there are 5 provinces that recorded the highest increase in recovery, namely Jakarta, West Java, East Kalimantan, Lampung, and Riau Islands. The developments in positive cases and death that have improved this week deserve our appreciation. This positive development is also in line with the development of COVID-19 examinations and the filling of beds in the ICU and isolation rooms at the COVID-19 referral hospitals. Since the 2nd week of January, COVID-19 testing in Indonesia have reached 100% of the WHO's target, which is 1 per 1,000 population per week. And as of February 7, 2021, testing coverage had reached 106%, or 287,131 people were tested in 1 week. This is the 5th week in which we have successfully maintained national level screening coverage above the WHO target. Even so, it is still a challenge to even out this coverage for all provinces in Indonesia, because currently the audit capacity still varies between regions. Furthermore, we see that the bed occupancy at the national level also shows signs of decline. After witnessing an increase for 3 consecutive months since November 2020, the bed occupancy rate this month has fallen from 58.4% to 52.06%. The implementations of the PPKM in the district city level in the last 4 weeks has shown commendable progress. Thus, the policy to extend PPKM on micro basis up to RT and RW level, whilst still continuing the former, is anticipated to further impact positively towards the COVID-19 developments both at the national level as well as in Java and Bali Island. Next, I will explain a bit further on the latest policy supplementing current regulations with micro-scale mitigation. This policy is follow-up to the President Directive to extend restrictions on community-based activities with micro-based and also the establishment of command posts to supervise the specific implementations of COVID-19 control in their respective regions. The regulations for extension of micro-based PPKM has been effective since today, 9 to 22nd February 2021, and the policy points are contained in the Domestic Instruction number 3 of 2021, as are the district and city PPKM policy points. In principle, the PPKM regulations at the Inmendagri are quite similar to the previous regulations, namely Inmendagri 1 and 2. But what I will emphasize are the different points in this latest release, including the limitations on employee capacity in offices and restaurants visitors from 25% to maximum 50%. I need to emphasize the easing of these rules aren't baseless. Based on the results of the evaluations of the previous PPKM implementations, efforts to limit macro alone may not be right on target, and thus the government seeks to implement a new strategy that focuses more on control at the micro level to ensure that the restrictions on community activities are more precisely targeted. Inmendagri number 3 also explained the coordination, supervision, and evaluation mechanisms for the implementations of the micro PPKM, which will be carried out by the command post or POSCO at the village or kelurahan levels and involves neighborhood or RT and RW, Satlinmas, Babinsa, PKK, Posyandu, Dasawisma, religious leaders, community leaders, health workers, and also youth organizations. Specifically, related to the implementations of the zoning policies for area controlled down to the RT or neighborhood level, there will be 4 types of zoning with control scenarios that adjust to each zoning, including the green zone, means an area without positive confirmed cases with a control scenario, namely active surveillance and routine monitoring and still carrying out testing and quarantine on suspects. The yellow zone means an area with 1 to 5 positive confirmed cases during the last 7 days with a control scenario, namely finding suspected cases and tracing close contact as well as independent isolations and close supervision. The orange zone means an area with 6 to 10 positive confirmed cases over the last 7 days with control scenario, namely finding suspected cases and tracing close contact as well as independent isolations and close supervision, and the closure of places of worship and other public places except those involving the essential activity mentioned in the same policy. And the red zone means an area with more than 10 positive confirmed cases during the last 7 days with a control scenario, namely finding suspected cases and tracing close contacts and independent isolations, close surveillance, shutting down houses of worship, and other public places except those involving in the essential activities that have been mentioned in the same policy, with the addition of prohibition of crowds of more than 3 people, limiting mobility outside the home after 8 p.m., and eliminating social activities. The micro-based PPKM implementation monitoring will be carried out by the POSCO at the village or kelurahan level. In carrying out its function, the POSCO will collect case data down to the RT or RW level or neighborhood level, process the data, and create zones based on the results, which will be subsequently result in specific COVID-19 control measures for each zone. Referring to circular number 7 of 2021 from Task Force concerning the extension of travel provisions for domestic people during the COVID-19 pandemic, travel regulations will apply starting on February 9, 2021. On this occasion, I will try to explain this rule briefly to our international media colleagues. First, for domestic trips destined for Bali Island, different regulations will be applied for those using air, sea, and land routes as follows. For air travel, travelers are required to show a negative RT-PCR test certificate, the sample of which is taken a maximum of 2 times 24 hours before departure, while a negative certificate for the antigen test samples is taken 1 times 24 hours before departure. For trips to Bali by sea and land, both private and public, it is mandatory to show a negative RT-PCR or antigen certificate with samples taken a maximum of 3 times 24 hours. Second, for travelers traveling to Java Island and outside Java Island are as follows. Travelers using air transportations are required to show a negative certificate RT-PCR test for COVID-19 with samples taken maximum 3 times 24 hours prior to departure, or a negative certificate for COVID-19 antigen test results with samples taken a maximum of 2 times 24 hours before departure. And travelers using sea transportations are required to show a negative RT-PCR test result with samples taken maximum 3 times 24 hours prior to the departure. For private transportation, it is advised to conduct RT-PCR or antigen testing 3 times 24 hours prior to departure. Especially for those traveling by train, if you do not wish to do a Genos test at the departure station, it is hoped that you will prepare a negative COVID-19 certificate, either RT-PCR or antigen, whose samples are taken a maximum of 3 times 24 hours before departure. For people using public land transportation, please note that a random antigen or Genos test will be conducted if needed by the regional COVID-19 task force. Finally, especially during long holidays and religious holidays, including Chinese New Year tomorrow, long-distance land travelers using the train and private vehicles are expected to show a negative COVID-19 certificate through the RT-PCR or rapid antigen or Genos test taken within 1 times 24 hours before departure. Please also note that all travelers, whether using public or private modes of transportation, must fill out the EHAC form, which can be accessed online. If the results of the RT-PCR test or rapid antigen test or Genos test of the travelers are negative but show symptoms, the travelers may not continue the journey and are required to carry out RT-PCR diagnostic tests and self-isolations during the waiting time for the results of the examination. In accordance with the circular, head of the ministries, institutions, armed forces, police, state-owned enterprises and also local state-owned enterprises and regional government are requested to prohibit civil servants, employees, soldiers, and members of the national police from traveling. In addition, leaders of private companies should urge their workers not to travel. Ministries and institutions, armed forces, police, and local governments, as authorized agencies, will supervise and implement health protocol disciplines and law enforcement in accordance with the provisions of the applicable laws. If there is a violation of the health protocol and falsification of the RT-PCR test results or rapid test antigen or Genus test used while traveling, they will be subject to strict sanctions. Furthermore, in order to adapt to the latest COVID-19 conditions, the government also addresses the outflow of foreign travelers as stated in the Task Force number 8, 2021 circular. In principle, the differences between the traveler circular letter number 8 and the previous ones are, first, foreign citizens are allowed to enter Indonesia on conditions that they are visa and residence permit holders in accordance with the Permen Kumham number 26 of 2020, permit holders according to the Travel Corridor Arrangement Scheme, and foreigners with special considerations or permit in writing with the ministries or agencies. Second, regarding the location of isolation for Indonesia citizens, it can be borne by the government at the Wisma Atlet Pademangan or independently at the hotels recommended by the COVID-19 Task Force. In the decree of the Task Force number 9 of 2020, Indonesia's citizens who are able to apply for an isolation mechanism at the government expense include Indonesian migrant workers, students, and state civil apparatus on international business trips. Third, the quarantine obligations will be exempted for foreigners who hold diplomatic and official visas related to official visits at the ministerial level and above, and foreigners with the Travel Corridor Arrangement Scheme. It should be emphasized that the entry mechanisms into the Republic of Indonesia for excluded parties does not eliminate other obligations in implementing other health protocols. Fourth, there is an appeal to continue quarantine independently for 14 days after the second PCR test result have come out before deciding to continue the trip. Both the Circular Task Force number 7 for domestic travelers and Circular Task Force number 8 for foreign travelers will be used continuously indefinitely, whereas the previous it was always updated every 2 weeks. This policy determination hopes to reduce confusion in the community regarding the applicable policies. But in the future, it does not rule out that this policy may change based on the current state of COVID-19, thus requiring the evaluations to be carried out every 2 weeks. Currently, 1,017,186 health officials have been vaccinated. The number is more than half of the targeted health officials of around 1.5 million. Indonesia government encourages all health workers who are yet to be vaccinated to participate in this vaccination program. It's worth noting that the health workers are those who are in direct contact with COVID-19 patients in hospitals. Thus, they are prone to the transmission. The vaccination will protect them and will prevent the transmission between patients and the health workers. Indonesia is doing its best to obtain COVID-19 vaccine for the public. As we know, the current vaccine we have obtained is Sinovac, which previously had age restrictions for the users. However, looking at the towering death toll caused by this pandemic, the elderly population are being considered as a priority for the vaccination program. In response to the issue, National Agency of Drug and Food Control, or Badan POM, has discussed with various stakeholders in health sectors on February 5, 2021, and Badan POM issued the emergency use of authorization for Sinovac vaccines toward the elderly population of age 60 and above. There will be 2 doses of vaccine administered between 28 days for the first injections. For this phase, the priority will be given towards elderly health workers whose age are 60 years and above. Other than the vaccination program for elderly, the government is also preparing the second stage of vaccination for public officials. For this stage, the Bio-Farma will start the productions of Sinovac vaccine, and hopefully Indonesia will have the sufficient supply independently and will be ready to commence the next stage of vaccine after the vaccinations program for health workers has ended. Respected media, although our road to the end of COVID-19 is a long and winding one, I hope that we will be able to develop our compassion and not our hatred to react with global solidarity. Both the pandemic itself and the resulting economic crisis are global problems. They can be solved effectively only by global cooperation. Part of this collaboration is sharing information globally. Countries should be willing to share information openly and humbly seek advice, and should be able to trust the data and the insight they receive. We should eliminate the tendency to tear each other down, but rather focus on each other's effort and lend a helping hand when and if needed. Global cooperation is vitally needed on the economic front too, given the global nature of the economy and supply chains. With these collective efforts, I believe that soon enough our fight against global pandemic will end, and I hope by that time we'll grow stronger as a community. That's the end of the two-day press conference, and I will now answer questions from the media. Thank you.
Thank you, Professor. There are 2 questions for today from Chandni, the Australian. Are there any plans to open schools now that restrictions for malls and workplaces have been relaxed? Thank you.
Thank you, the Australian. For the formal education sector, the Minister of Education and Culture stated that education providers may carry out face-to-face learning in the 2020-2021 even semester. The final decisions is entirely in the hand of the local government, the local education office, the school, and the parents, while still taking into account the readiness of the facilities and the infrastructure to implement health protocols. We hope that the authority entrusted by the central government to local governments can be carried out properly, namely on the basis of careful preparation, including the implementation of simulations and gradual opening. On the other hand, the social and economic sector have started operating since last year with adjustment in capacity limitations. Regulations on operating hours are adjusted to the decisions made by the head of the region. However, specific for Java and Bali Island regions that is currently implementing PPKM until February 22nd, the maximum capacity will reach 50% based on the instruction of the Ministry of Home Affairs number 3/2021. This gas break policy decision must be taken wisely and carefully. The government is trying hard to keep the community productive while still ensuring their safety. In principle, during this pandemic, the health and safety of the community is the government priority.
Thank you, Professor. The next question is, with the news about new strains of COVID-19, is there any worry that the vaccines we have may not be as effective against these new strains? Thank you.
Thank you. The latest findings from the LBM Eijkman under the supervision of the Ministry of Research and Technology, who runs the whole genome sequencing for potential variants of the mutations of the COVID-19 virus states that the number of the genomes that have been collected to GIS8 or influenza data bank in the world is 244, and B117 mutations have not been found to date. However, the D614G mutation has been widely found. In principle, viruses consistently undergo small changes as they spread among humans. It is possible for a virus to mutate and render the vaccine as less effective. Nevertheless, this only happens when the changes are very extreme. But keep in mind that science is developing. The COVID-19 pandemic is also very dynamic. Hence, the government continues to try to anticipate the worst possible outcome that may potentially exist in the future. Meanwhile, Indonesia will continue to carry out genomic surveillance. Thank you. With this, I would like to thank all of the media for your attention to this press conference. I hope that all informations are beneficial and sharing this to the world message. Thank you very much. Wassalamualaikum warahmatullahi wabarakatuh.